Good morning and welcome, and I am Dr. Peter Holmes, orthopedic surgeon, and I am host of your program, Ask the Doctor. My guest this morning is Dr. Alex DeJesus, and Dr. DeJesus is a rheumatologist. If you have any questions for Dr. DeJesus in the future, any of my other guests, there's two ways to reach me. You can email me at needoc, that's N-E-E-D-O-C, at AOL.com, or fax 696-9012. I'd like to talk about the demise of medicine once again with the aid of politics. Heading into an election season, in case nobody's noticed, and all of a sudden we're trying to buy votes by figuring out how the government can help pay for 45 million uninsured, etc., etc., etc. Remember, the government's you who are paying taxes. Well, let me tell you, in my opinion, a large part of the uninsured is due to the government. So let's look at the uninsured and see perhaps who those people are. First of all, I bump into a large number in my practice that are uninsured simply because they have a fair amount of money and they don't care to buy insurance. They just buy their health care. Not very many, but that's one group. Second group is a large group that should be buying health insurance, but due to their choice and lifestyle, elect not to. I'm talking about people that make between 60 and 100,000 and up that have no health insurance because they say it's too expensive. Well, they live in a $300,000 house and they have 3 cars. They can afford that, but they feel that the government, that is you paying taxes, should cover their health insurance rather than them shelling out the $5,000 a year or so for this. So there's a large group like this. Indeed, there's a large portion, some portion of those who will never be able to have a job, who are sick and they definitely need coverage. And guess what? That's what we try to do through the county hospital here and the state hospitals. And I think we do a pretty good job, as I am faculty there. Next group is those who are retiring after working, let's say they're age 60. Well, if you're 60 and try to go get health insurance, it's pretty expensive. And they hadn't saved enough in their HSAs because the government hasn't allowed them to save much in their health savings accounts because, God forbid, they should be able to save it while they're working and get tax deduction for it. That's a break for the wealthy. But once they're retired, now they're 60 and uninsured. That's another group that could be helped with HSAs. But a very large group are the young. I see a very big number of people between the age of 18 and 30 with no health insurance. And the reason is they can't afford it. And the reason they can't afford it is because of the government, in my opinion. And this is due to price shifting. They are paying what Medicare should be paying to hospitals on their own premiums if they were to buy health insurance. For example, I recently did a total knee replacement in a patient, and he showed me his hospital bill. It's $40,000. So I went, okay, wow, looking through it. It's the same bill that the hospital sends Medicare, $40,000. Well, Medicare pays the hospital less than $10,000 under a price control arrangement. They just say, you're getting $10,000, take it or leave it. The hospital is getting $40,000 from the young person who had the knee replacement. So the hospital is getting $50,000 from 2 people, or $25,000 on average. Well, guess what? The real cost for the total knee replacement should be about $25,000 on average. That's for the hospitalization, the rehabilitation, the implant. We're not talking surgeon fees, just the hospital bill. So the additional $15,000 that Mr. Smith is paying is to cover the shortfall that Medicare is not paying. So what happens to Mr. Smith's health insurance? Well, his rates are going to reflect the higher amount he paid. Same as car insurance. If you're in a bunch of car wrecks and you give USAA or some other company some big bills for your car wreck, what happens to your car insurance? It goes up. All right, it goes up substantially, and it reflects how much you pay. So the same thing with private health insurance. If a large number of bills, high number of bills come in, then the health insurance has to go up accordingly to cover those costs. All right, so let's get back to the young person. The young person has very little hospitalization. If you take 1,000 young people, very low hospitalization. If they do, they're not in there very long at all. But their health insurance premiums reflect an average of the population, of which a large part of the Medicare underpayments to hospitals, etc., are dumped onto the young people. So a young person under the age of 25 should be paying less than $1,000 a year for health insurance based on what they need as an average pool. Instead, they're paying $5,000 to $6,000. I know this because I pay the premiums for my young people. Now, let's look at it the other way. Let's say you're 55 years old and look at your car insurance. Car insurance for a 55-year-old is about $1,000. Car insurance for my maniac driving son is about $4,000. It should be, because it reflects how he drives. Now, what if they took my maniac son's across the border car insurance and added it to Mr. 55-year-old? All of a sudden, your 55-year-old bill for car insurance would be $3,000–4,000, and you'd be upset. But it reflects the overall population average if you dump one group on top of the other. So the solution, the government says, well, now we have 45 more million people that are uninsured, in my opinion caused by the government, so we're going to insure those people through the government. This is going to amplify the problem. Now you have 45 million more under price controls. Those price controls are going to dump more of the load on top of those who are paying insurance. Their insurance rates are going to go up. The insurance rates go up means fewer are going to pay for the health insurance, so they'll be more insured. We'll go from 45 million to 55 million to 65 million. After a while, everything getting dumped, nobody can afford insurance because of the underinsured payments. Price shifting. Price controls. Price controls price others out. Price controls shift the burden from one group to another with an added bureaucracy of the government. Price controls cause the uninsured, in my opinion. If you have any comments, 2 ways to reach me. Email me at needoc, that's NEEDOC @AOL.com, or fax 696-9012 to ask the doctor.